Okay, well, I'm going to go ahead and get started today. Over the last week or two, I've been, well, actually, I saw a video where there was a lady that said she works 70 hours a week and that she works 7 days a week. You all may have seen that. It was about needing caregivers in North Carolina. So they interviewed this lady. She worked for one particular home care company, and her client was talking about how much she helped her. And then she said, they talked to the aide, and she said, well, I work 70 hours a week and 7 days a week. And I thought, that is a lot. And she seemed to be managing well, but it made me think about how working too much causes stress and burnout, and how it can affect an agency when something like that happens. So that was the source of this, and that's what I'm going to go over for you all today. So first of all, we need to talk about what is caregiver burnout, or what is, and a caregiver and an employee are pretty much the same in what I'm going over today. But this could also be a caregiver, a family caregiver. But I mostly want to talk about your employees and how this can affect you. But it's physical, emotional, and mental exhaustion that's caused by excessive or prolonged stress. Now, we know that the people that work in home care, they have lives too. There's stress in their personal lives and all around. And then they work for a home care agency where they're supposed to be a source of comfort for their clients, and they have to always put on a good face. That's just standard for healthcare. And so home care has some unique factors in that there's a lot more that you deal with because you are in someone's home. And some of the signs of stress in home care employees, or any employee, would be fatigue, sleep disturbances, physical ailments. We see that they may not enjoy their job as much and not be motivated. And you'll kind of hear that when you chat with them. They can't concentrate or make good decisions. And we know in home care, we need our people to make really good decisions because they work on their own so much, and they don't have anyone right there with them all the time. Also, they may not be as productive, and their performance may decline. So that would be in any area of life, but in healthcare in particular. So some of the common things that you see in home care would be they work irregular and long hours. And just keep in mind, most of the time, the people working for you, they're working with other agencies too, because they may work for you 20 hours a week and they may work somewhere else, different hours, and it may not be a regular schedule. So that's a big stressor. And then they're balancing multiple clients and responsibilities. I was just talking about how going into the home is so different. When I first started my home care agency many years ago, I had been a hospital nurse. I had worked in facilities. So one of the things that I wanted to know was, what is it like to go into someone's home and use the things that they have to provide care or whatever I had to do. So one of the very first clients I got was in Durham County. It was someone that had called the Department of Aging. And this particular lady lived with her niece, and she wanted her to get a sponge bath. She didn't let her get in the tub. She wanted her to get a sponge bath like every week. So it was just a one-time thing. It only took an hour or so. So I felt that would be a good opportunity for me to see what it was like to go into someone's home. And it was really an eye-opener. Because once I got there, of course, you've got all the physical things in the home. And then the niece who had been giving her the bath had all these requirements, like this is the basin that I use. This is the soap that I use. This is the amount that you put in the water. Just things that I really hadn't thought of. No, but it's highly relevant. I mean, it's good and that's what you do. But it gave me an appreciation for what my people would be going through when they started working. So, and this draws right into this. They have a lack of control over the work environment because everyone's home is different. Some people, when I went in and did assessments as an RN, some people have a huge bathroom and a shower chair. Others have, especially older homes, may have a really tiny bathroom. They may have these thresholds that you have to step over, just many, many things. And a person working in home care has no control over that, yet they have to perform at a high level. And then there's the physical demands, such as assisting a client from a chair, to the bed or whatever, using a wheelchair. And many times there's no one there to assist. I also had a situation where one of my aides had been working with this client for a very long time. Everything went well. She could turn her over and everything that she needed to do. One day she went into work and she tried to move the client. The client had gotten weaker overnight and just not sure what had happened. And so she hurt her arm because it was a change. So she did have an injury from that, and it had never been a problem before. And then many of the aides that work in home care, and we want them to be close to the clients, because I used to tell my aides, if you cannot take care of this client the way that you would take care of a family member, then you're in the wrong business. So when you have aides that become close to the clients and they become friends, when that client's health declines, it has an effect on them mentally. And then you also have changes in client behavior, and they have to deal with that and not respond to it in a negative way. And as I said before, they're working in isolation and they have limited social support. So that's when the manager needs to stay in touch with them. So how does it affect your agency? All the things I just went over. There may be a high rate of medical or healthcare errors. Now, we don't give medications or anything in home care, but there could be other things. Maybe they don't quite get the TED hose on the way that they should because they're too tired, or they're irritated. They hadn't slept. Maybe they are walking up to the house and they stepped on this step many, many times, and today they tripped. So there are things that fatigue will cause over time that it's just something we need to keep in mind. And then, is the patient still satisfied with their care? Because if the aide is fatigued all the time, then the client may not be satisfied. And then you get high rates of turnover and job satisfaction as well. So there's the client satisfaction that I just talked about. And then in order to effectively run an agency, you need a consistent workforce. You need aides working every day. You need backup. So the cost could be, if they're moving from agency to agency, that you don't have enough people to work. And then an agency cannot make money without people to do the hours and do the work. So you have to have the ability, the agency needs these people in order to increase their income and to have good client satisfaction. And your employee stress, that's going to equal management stress. Because if they're stressed and all of these things are going on that I just went over, that's going to cause stress for you. And some of the things that an agency can consider doing as far as prevention is try to offer some type of flexible scheduling and workload distribution. Now, a lot of people come into home care because of the flexible schedule. However, they want a certain number of hours. But if there's a way that you can, if someone has just too many hours and they're working too much, that maybe you can work with them on that, or add another aide to the case to work one of those days a week, or just anything that you can do to make it more flexible. And when your aides work during the day, you need to be sure that they have a way to take a short break. Even if it's just stepping outside for a minute, or some way to take a break during the workday, and then that they take some time off. It's always good if they know that they're going to get a vacation, a few days off once or twice a year, if you all do it that way. But that is a really good thing, because there's documented research that says if you're planning to do something good, a vacation or whatever, if you're making the plan, that you get some joy and happiness out of knowing that it's coming. So it's not just during the vacation, but planning for the vacation also counts too. And then you can encourage counseling and mental health support. We know that mental health is so important now. So you might want to suggest that your aides take advantage of the counseling and mental health support that they may have in their insurance plan that they never thought about using. It is not a shame. It's something that if it's available, they should take advantage of it. And then some of the support that you can provide for them is encourage them to openly communicate with you as an employer. And then when they communicate with you, follow up. If someone comes in and tells you that there's a particular problem at home, they're not asking you to do anything. They're just sharing with you what's going on. Then when you see them the next time, you might say, how are things with such and such? Did your daughter get in college? How are her grades? Just a little something to let them know that you remembered what they said. Many times people don't want you to do anything. They just want to be heard. And that goes a long way. And then if you have peer support programs, when you hire someone new, are you going to put them with another employee? Now, it needs to be an employee with a good attitude and that does a great job. But those are particularly helpful, that they have someone they can turn to and count on that does the same job that they do. And then recognition and rewarding the employees, that is really a great thing. And it really doesn't cost a lot. Some of the things that I used to do was we always sent them a birthday card on their birthday. And that was something we routinely did. And we sent them a Mother's Day card at Mother's Day. And one day I was in the office and one of the aides came by and she said, oh, that Mother's Day card was the most beautiful thing I have ever received. And she was kind of tearful. And she told me that several years before that, her son had been killed in a motorcycle accident on Mother's Day. So you just never know what's going on, but just small things, a birthday card, Mother's Day card, or whatever, those don't cost a whole lot, but it could mean a lot. And then I talked about peer support. Those people, the peer person can make sure that they tell the person that they're working with that you are doing a great job or you can do this differently. And when they report that to you, you can go back and follow that up and let them know the person you've been working with says you did a great job with Miss Jones last week. And I just want to thank you for that. And make sure that when there's special holidays, Christmas especially, that you give your employees something. It may be a Walmart gift card. At Walmart, they can buy anything, but just a small token, something that they can use. Those are just some of the ideas that I have, and you all may have many more. So as always, I like to let you all know that I'm happy to provide this information each month. But before you make any changes to your agency or anything of that nature, that you make sure you go ahead and call the regulatory agencies and make sure that they want you to make that change before you make a change based on anything that I have provided for you in this forum.